but I really wanted to hand it over to the star of the show, and Dr. Paine, to do a quick intro, but to dive into the Four Horsemen. So,
well, thank you, Chris. So, a little bit about my background. I am a primary care family medicine doc. I've been doing that for over a decade, and I've had the opportunity to kind of work in a broad spectrum of care, from everything from outpatient medicine to the hospital to nursing homes as well, kind of the full spectrum of life. And you often will see kind of the consequences of life as it adds up, and as we get to our later years or later seasons in life, of how chronic illness really makes just such a big impact on our ability to do the things that we want. So we talk about our health span, but really kind of looking at our independence and other things too as we age. And so I've had the opportunity since then to go and understand a little bit more about obesity, really kind of diving into some of the lifestyle things that we can be doing now to help prevent those things from coming, or at least delay the onset of some of these chronic conditions. Trained in North Carolina. I've been here in Richmond for about 11 years, thereabouts now. Married 17 years, 2 kids growing up at loving Richmond. And so I've got a couple things. Love the weather, right? This is my favorite time of year, right? Fall, as the weather kind of gets cooler, we find that we start to see things start pop up, right? To think about pumpkin picking, apple picking, right? But my wife and I had a disagreement, so I need your help for me to help me figure this out, okay? I really like pumpkin spice, whatever it is, it's my favorite. She's an apple caramel, kind of salted caramel kind of person. So who likes apple and caramel? 1, 2, 3, 4. Okay, who likes pumpkin spice? All right, pumpkin spice wins. I can take that back and let her know that she's in the minority there. But Chris asked me to come and be able to talk to you guys about kind of what I get to talk about people all the time, about where they are in life, what they're hoping out of life, where they want to see themselves in 5 years, 10 years, 20 years. Peter Attia, he talks about this thing called the centenarian decathlon, right? What do I want to be doing when I'm 100 years old? And how do I start making changes now to prepare myself for that, right? Do I want to be able to carry groceries into my house? Do I want to be able to go up and down the stairs? Do I want to play with my grandkids, my great-grandkids, right? And we know that as time goes by, we lose things like muscle mass and strength. Our health does change, and so there's got to be things that we can be doing now to really kind of start setting ourselves up for success. So when we talk about that longevity, yes, we all would love to be able to live longer, but it doesn't mean as much when we're not able to do the things we want and maintain our independence. And so really kind of focusing on how can we get you to where you want to be. So next slide, if we can. So thinking about, I kind of got some financial things in here, right? The ultimate investment, right? The proactive approach for longevity and health span. So as you think about financially, you guys are diversifying, you're trying to find ways to invest financially for financial security. And we can do the same thing as it goes to our health. What can we be doing now? What kind of investments can we be making on ourselves so that we can have that physical and health security down the road? They say a life lived well is super important. So let me see another raise of hands. How many of you guys have had health advice that was confusing or overwhelming? Everybody feels like their health advice is pretty solid. Well, I love that. You guys must have a very good team around you. But a lot of folks will find that kind of the health advice is sometimes it's confusing. Sometimes their doc doesn't quite understand what their goals are. Sometimes you get it from different sources and they're conflicting, and it's hard to understand what's going on. So just like with financial advisors, they give you advice, there's guidance, and hopefully I can provide a little bit of guidance to kind of get you started on the road as to the things you can be doing to make those investments in yourself for better health. So we'll go to the next one. So Chris kind of alluded to this a little bit. I mean, there's different models of healthcare, right? And then when we think about kind of the frame of mind of like medicine 1.0, 2.0, 3.0. Medicine 1.0, go way back, talking about humors, good humors, right? These are the kind of the miasma that's around that may affect your overall health. Is it in the air? What was it that was going on? And then a couple hundred years ago, looking at germ theory kind of start to show up. We start to understand really what's the cause of disease, especially acute diseases like infections. And a lot of health care today is based around those kind of same understandings. Their goal is to treat the acute condition, fix the acute problem, fix the broken bone, right? Treat the infection. But those things don't quite get to prevention. They don't really quite address some of the chronic diseases that begin to show up. If you look at improvement over time, you see great improvement after the invention of gene theory or kind of discovery of bacteria and things until about the 1900s, 1950s. And then there really hasn't been a great big change in outcomes and longevity and health span or lifespan since that. And a lot of that is related to chronic disease, right? Managing things like hypertension and preventing heart attacks and managing diabetes. We're doing a lot better. We've got lots of great medicines and other things that are there. But really kind of outcomes, it hasn't shifted the needle on things like longevity. And so we're starting to see that investments made early have some compounding over a lifetime that can really make changes for your overall kind of health. And so the new model, talk about that healthcare 3.0. How can we be proactive? How can we be looking forward? How can we be utilizing things like technology, some more of these advanced labs and health coaches, a team of folks around you to really kind of optimize your health. So, I mean, thinking about how we track financial kind of gains, right? Watching the market, there are a lot of things that we can start to do to begin to be able to monitor our overall health. There are things that we can kind of invest in, whether it's nutrition or physical activity, sleep, social connections, that will begin to move the needle and really help, even if we're not extending lifespan, really extending that health span to make sure that we're staying independent and doing the things that we love. So Peter Attia in his book kind of said that it's not enough to plan for that financial independence, but the ultimate goal is to have the health and vitality to enjoy the freedom that financial success provides, right? So if you're thinking about, hey, I'm saving up for my future, I've got this big nest egg, you want to be able to use it. You want to be able to kind of see the fruits of your labor. And I imagine many of you have kind of seen friends and family members and folks of church that have worked hard their entire life and put that money aside for a future they saw, and then had the cancer diagnosis. They had a traumatic injury. They had changes in their mental health, or even things like dementia that really kind of stopped what their movement towards what they wanted, and didn't allow them to reap the benefits of what they had been saving up for their entire life. So we talk about the four horsemen, right? So does anyone know the actual four horsemen? Like, so we think about death, war, famine, and pestilence. Okay, these are the four horsemen. So they're not the four horsemen I'm going to be talking about today, though they may contribute to death and pestilence, right? But The first one, we're really thinking about metabolic dysfunction. So these are the kind of chronic diseases that cause a lot of significant illness in the U.S. These are things like diabetes, pre-diabetes. These are things that insulin resistance, metabolic dysfunction, where the hormones that control things like blood sugar, hunger, our body weight, they're dysregulated, they're out of balance, right? So it causes a significant amount of disease. And the next one, cardiovascular disease. I mean, these are things like heart attack and strokes. While metabolic dysfunction may be a slow change in health over time, cardiovascular disease is often realized like this, right? You had the heart attack, you had the stroke, but the truth of the matter is those things didn't just happen out of the blue. They've been developing over decades beforehand and reached a point where really things changed, right? So there's cardiovascular disease. Neurodegenerative diseases, this is things like Alzheimer's and Parkinson's disease. And we're starting to find more and more that these may be at least somewhat related to lifestyle over a period of time. Poor sleep, bad nutrition, exposure to risky substances. These things are starting to come up to say, hey, they may be related to Alzheimer's and Parkinson's, and there may be ways that we can start to move the needle and reduce our risk for developing these in the future. The next one, the last one's cancer. And there are a lot of cancers out there, and regardless of what we do or how we manage things, that they're going to happen. But again, just like neurodegenerative diseases, we're starting to find out that lifestyle plays a big role in not only developing cancers, but also how do we manage it once we're diagnosed, and really preventing kind of reoccurrence of cancers down the road. So, go back one. When you guys think about these four horsemen, which ones come to mind as the biggest kind of risk in your lives, if you're thinking about, or maybe in just general population, which ones jump out at you? Cancer, cardiovascular, right? These are big things that kind of feel out of our control a lot of times, right? And can really change life really quickly, right? And so we'll find that oftentimes there's a lot of interconnection between these, and so they're not siloed in one or the other. Like often can happen in conjunction with each other. How many people do we know that have got high blood pressure and diabetes and kidney disease and all these other things? So, okay, next slide. So I want to talk about our investment strategy, right? So I can tell you of all the facts about how bad the outlook can be and the cost of healthcare as we move forward, but that's not going to give you guys kind of those tools to what's next. So what can I be doing today? What can I start to move the needle for these things? And so I want to lean on these 6 pillars of lifestyle medicine. So lifestyle medicine really looks at ways in which we can manage our chronic health and hopes to maybe reduce our reliance on medications and probably therefore reduce potential side effects from those medications, right? They can, when dosed correctly, be more effective sometimes than some of the conventional treatments if you got the right coaching and you got the right application at the right concentration. We can get even better outcomes than some conventional treatments, and it may be safer than some of the conventional treatments too. So the 6 pillars of lifestyle medicine are nutrition. So think about that from a financial standpoint. This is like your daily cash flow, right? This is what we're putting in every day. The second one, physical activity, right? This is building that principle. What's our baseline level going to be? The third one, stress management. So hedging against market volatility, right? We're going to have stress, but how do we kind of figure out how to manage that? Restorative sleep, so this is going to be return your daily capital return, social connections, the dividend of community, and then avoidance of risky substances. So really limiting high risk, low reward assets, really kind of how can we cut some of these things out that may not be serving us well. And there was a study done in 2000 that was published in the journal American Medical Academy in 2005. They did a survey of 150,000 people on lifestyle habits. And they looked at everything from nutrition, weight, smoking, all those kinds of things. And so I'll go through the top 4. So non-smokers, about 76% of folks were non-smokers. Excellent, right? Moving the needle there. Healthy BMI, so that's a BMI, body mass index, less than 25. About 40% had that. 5 servings of fruit or vegetables a day. 23% of folks had that. Regular physical activity, 22%. So you want to look at that whole population, only 3% of that 150,000 people had all 4 of those, right? And what we know is that by addressing those 4 things, we can significantly reduce our risk for heart disease, stroke, diabetes, kidney disease, cancer, right? So maybe we can all get into that 3%. Maybe hard, right? Maybe, but even if we say maybe we meet one of those, what would it take us to get to meeting 2 of those? You know, if I'm not a smoker. Yeah, so non-smoker, right? So tobacco use, BMI less than 25, 5 fruits or vegetables a day, and regular physical activity. And I'll get into more about kind of what those really look like, but just amazing, only 3%. So where can we move the needle, right? If I'm a non-smoker, but I'm not active, I'm not getting my veggies, and overweight, right? Where can I move that? Can I get 5 fruits or vegetables a day? And then you're going to be working closer to what you want to do, what your goal is, right? So, so that first pillar, nutrition, right? So nutrition is probably one of the big things that, I mean, most of us could probably make changes in, right? Not all of us have the greatest diet. When you think about what nutrition does, it directly combats that metabolic dysfunction. You know, when we look at insulin resistance, nutrition plays a super role in that, but we can also see decreases in heart risk and cancers, right? So if you think about diets in America, the standard American diet is highly processed foods, right? High in carbohydrates, high in saturated fats, sugar-sweetened beverages, right? There's a reason why they abbreviate the standard American diet as SAD, right? Because the way we eat is kind of sad. And when you look on the other side, so our standard American diet here, look on the other side, it's got data saying this is maybe ideal. This is a whole foods, plant-based, plant-predominant diet, right? And what they see as you kind of move along that spectrum, you have different things that you find. So Mediterranean diet or DASH diet, you guys have maybe heard of that. Folks that are vegetarian, vegan, pescatarian, flexitarian, whatever you want to call it, right? They're somewhere on this spectrum in between your standard American diet and maybe an ideal whole food, plant predominant diet. Okay, so what does that mean? Whole foods? It just means less processed, right? You're using those ingredients that are from the outside of the grocery store and not on those inside aisles, right? And by doing so, you're eliminating the use of highly processed ingredients, things like high fructose syrup, corn syrup, artificial sweeteners, artificial colors, right? And so trying to find a way to move towards that, away from the highly processed, high salt content, poor nutrition density foods, and then plant predominant. And the reason why a lot of times, especially the lifestyle medicine folks, focus on plant predominance is because there's so much more benefit that we get with our plant-based foods. So vitamins, micronutrients, phytochemicals. These things help support the metabolic system, but they also help as antioxidants. They help reduce things like your risk for certain kinds of cancer. And so getting those things in your diet are going to help kind of deposit healthy things for your future down the road. So no one's typically on one end or the other. The folks that are here probably are saying, yeah, I try to eat somewhat healthy, but most folks are probably not. I'm on that whole food, plant-based diet.
Where do whole grains fit into this?
So whole grain, so that's a good question. And so that fits into, moving towards this whole food, plant predominant diet, right? Well, it is, and it can be. It can be. So whole grain's a good question, and whole grains don't. For some folks, they may have a different effect than other folks, right? So if you've got diabetes, whole grains are better than white grains, but your body might process them differently. And so it brings up a good point, and kind of where I wanted to get to is we're somewhere on there. The research says that there's no one diet that's better than the other, right? But we're on a spectrum here. It's going to be very personalized. Where do you find that you're at? What's realistic for me and my family? What are my food sensitivities? What can I have? Maybe I can't have dairy. Maybe I've had tick bites and I can't eat red meat, right? Maybe gluten's an issue for me. Maybe, as much as I want to, my medicines require that I at least have some carbohydrates in my diet, otherwise my blood sugar is going to drop completely, right? And so what typically often recommend is say, figure out where you are in this big spectrum of things, and where can we begin to shift from that standard American diet or wherever we're at closer towards a whole foods, plant predominant diet. So is that meaning, hey, I only get 3 servings of whole fruits or veggies a day? Can I move to 4 a day? Is that something that's going to be realistic? Can I move from white bread to a whole wheat bread, right? And the fiber that comes in with the whole wheat is going to be significantly better for you than just the regular white bread, right? So where can we begin to make some of these small changes and work towards the kind of ideal? And as we're able to do that, right, we can increase our whole foods, plants, veggies, whole grains, beans, legumes, nuts, seed. Make sure we're drinking water instead of fruit juices and sugar-sweetened beverages. Decrease the fried foods, refined grains, lower of the red meats, the highly processed meats like deli meats and bacon and those kinds of things. What we see is we're really able to start to see reversal of some of those chronic conditions. Yeah.
With my sweet tooth, I'm wondering if you can name what artificial sweeteners are, because I chew gum that has sugar-free, but it has whatever else in it, and I can't pronounce all their names.
So there's probably 50 or so.
For the sake of folks who want to read the question.
Oh yeah, so the question is, can I identify some of those sweeteners that may be out there, because they're everywhere, and your sugar sweetened or the sugar-free gum and other things, right? So I could probably give you a list of 50 different names that are on the list, and I could probably find some resources to share with you guys. But this is everything from sucralose to, you'll see glucose, dextran, certain sugar alcohols and other things that show up on the label, right? There may be some that are better than others. Ideally, right, we can do away with them all completely, right? Because our body responds to them differently. It thinks there's sugar, it starts to affect our hormones go up to say, oh, there's sugar coming, and then it has to figure out what to do about it afterwards. Folks that, there's a study that folks that drink diet sodas typically consume I think they said up to 500 extra calories a day, because it's affecting their hunger hormones and other things too. So as much as we're like, yes, we're doing good, we're drinking our diet soda that has this artificial sweetener in there, I'm not getting the sugar, it's having other effects, right? And so if we can move away from sweeteners, great. But obviously I realize that it's not practical. A lot of times we do have our sugar, our sweetened tooth, right? So even moving towards things like stevia and monk fruit that may be a little bit more natural, that might not have as much of a glycemic index to them, might be better of a transition away from some of the other sweeteners that are out there, right? That's a good question. So really kind of identifying that area. And this is where kind of that relationship with your doctor or a health coach can be really helpful, because they can go through and spend time going, okay, let's go through the last 3 days and look at your diet and see what you're eating. Are there areas where we can find that we can set some small goals and we kind of move in that direction where we can eat a little bit healthier? So sometimes if you're able to come to your doc and say, hey, I've already kept track of this before I come in, it's going to help facilitate a lot of those discussions. Hey, these are the last 3 days that I ate. You can even take pictures of your food, not even write it down, and bring that in and show them, hey, these are my meals for the last 3 days. That way they can see what you ate. They can also see portion sizes and maybe help counsel and coach on that. So next slide.
Oh, could I ask a question?
Yes, ma'am.
What about vitamins?
Yeah,
in
that's a good question.
something?
And I could probably spend an entire, so the question was, what about vitamins, right? And so that could be, we could spend a whole hour just talking about vitamins. And that's another personalized kind of discussion, because sometimes we got vitamin deficiencies in which we need to have certain vitamins added back. If you're on a vegan diet and you're not getting meat proteins, you might need supplementations for things like B12 in your diet, right? But there's a lot of folks out there that are selling vitamins with claims that they fix everything, and they have no data to support it either. When we think about, hey, you take this vitamin that is going to help prevent cancer, maybe the data's not there. And so again, that's another personal, I think, discussion with the doc. Not every doc knows about the vitamins, but bring in what your list is, because it's important to share that with them so they can review it. And just another word on supplements. You got to be careful with some of them too. They can interact with our other medicines, right? Supplements like ashwagandha can also cause blood thinning, right? So if you're already on a blood thinner and then you start taking this vitamin or the supplement because someone told you it was going to be good and it's going to help with your diabetes, it could have other consequences too. So just that, bring in those lists, ask your doctor before you start something, just to make sure that's an appropriate thing for you to do. And they can help guide that discussion more.
Follow-up question. What about, there's a widely advertised product that says, take a capsule, it's fruit, all kinds of fruits in powder form.
Yeah.
And the other one is vegetables in powder form.
Right.
If you don't think you're getting enough fruits and vegetables in your diet.
Right. That kind of same thing, right? And so
that'll help.
That'll help,
You
right?
just take these.
So it depends on what they put in it. It's not regulated, right? They can have whatever they want in there and say it's good for you, right? So bring that to your doctor as well. I think it's a good thing. Ideally, from a nutrition standpoint, if we can get them in whole foods, that would be great, because it not only does it come with all the important vitamins and stuff, but it also comes with fiber, some of the micronutrients that get processed out when they grind them down and they say they put it in a capsule. So ideally, whole, if you get it from Whole Foods, the better, right? So the second one is physical activity, really building your principal and earning interest. So physical activity may be the best thing that you can do to help with longevity. So they looked at they look at grip strength oftentimes as a marker for overall strength. It's a surrogate marker. It probably has nothing to do with the actual grip strength, right? But they did studies that measured grip strength and how long folks live. And those folks that had the highest grip strength lived the longest. But it's because of overall muscle strength and muscle health. And if you think about it, over time, our muscles waste. We have atrophy. As we get older, our muscle mass decreases. But those folks that have stored up and stocked up ahead of time, right, they are able to better control their balance. They're less likely to fall, less likely to have a broken hip, right? They're more likely to be physically active and less likely to be sedentary. And so all of those other things are markers or things that contribute to overall health, right? After a hip fracture, you know, the risk of death in the next year can be up to 50%. And if you think about it, it's because folks are immobile, right? They're isolated, they're in pain, they're on more medications, right? And so if we can do everything we can do now to prevent those injuries in the future, whether it's working on stability and strength, it's going to help maintain that health span longer, your independence longer in life, right? So aerobic exercise, strength training, both are super important. Current recommendations are 150 minutes of moderate to strenuous exercise a week. Most folks do not get 150 minutes of moderate to strenuous exercise a week. But you know, the good thing about it is there's a dose relationship. So the more you get, the better benefit you get from it. And so even if we're not active now, just adding in some walking, even standing, can make a big difference. And so start where you're at. It may not be getting to 150 minutes, but maybe if I'm doing 1,000 steps a day, maybe I can get 2,000 steps a day and work towards that. Strength training also super important, right? If you think about this one as compounding interest, right? Over time, regular physical activity is going to really just, your returns are going to accelerate over time. This one's building your principle, the muscle strength, right? So that's everything from body weight exercises, doing things like chair yoga at home, or finding things like Tai Chi, to doing calisthenics, push-ups, squats, to getting in the gym, working with a trainer, somebody that's going to teach you exactly what to do. And so really thinking about that financial kind of investment, a physical investment, that interest and principle, these things go a long way. Also, you're seeing things like in cardiovascular disease, folks that have had a heart attack. There's a study that looked at the folks that exercised and they got them on a bike 5 days a week, and folks that had a stent placed. And at the end of the year, the folks that were on the bicycle had less heart attacks and costed about half as much, right? And so there are things that we can be doing with physical activity that not only can help prevent things from happening, but let's say we do have a heart attack, we can see improvement in our health conditions, even reversal in some of the calcification in those arteries, right? And so super important stuff. So next slide. Third one, stress management. I mean, who in here has some stress in their lives? All right. In my office too, we talk about nutrition and physical activity all the time, but stress is underlying a lot of what's going on, and we can't get away from it. Right? As much as we be like, okay, we just don't want stress in our lives, it's going to be there no matter what, right? And we're going to have stressful seasons and stressful events. But it is something that we learn to manage, and it's how we manage it that matters, right? So it talks about this, right? Chronic stress is a silent killer that can trigger a physical market crash, right? Like stress. We'll just push through, and then all of a sudden things change. Physiologically, our stress hormone cortisol is elevated during periods of physical and emotional stress, right? Cortisol is what historically would get us running away from our bear that was chasing us, right? So it's designed to constrict arteries to make sure that we're storing away energies and other things, right? So higher cortisol levels, higher risk for heart disease, higher risk for obesity, higher risk for diabetes, right? It's inflammation, chronic inflammation that happens with it. So what do we do? So we can go to the next slide, right? So yes, we all experience stress. I would encourage each of you to come up with a couple ways in which you manage stress, and write them down. This is kind of like your menu. When I'm feeling stressed and worried, what am I going to do to kind of manage it? And for some of us, it's mindfulness and meditation, right? How do I focus on this? It's a prayer, right? Is prayer what gets us through those stressful times? Is it journaling, right? So journaling can be a big thing to help separate us out from our emotions and have a more objective view of what our stressors are, right? Hobbies and leisure activities. Is it golf? Is it getting to see our grandchildren and playing with them? Is it travel, right? Are we using those financial gains to travel and find that leisure, right? Is it time in nature? Sometimes it's walk, sometimes it's going on a hike. So as you think about some of those things, does anyone want to share what they do to help manage their stress? Okay, other than alcohol, right? Yeah. Bible study, right? So faith, right? So faith, meditation. What else?
Exercise for me.
Exercise, right? Getting on, whether it's running, getting on the bike.
I meal prep on Sundays. I cook a few things to have for the week, and I love
Yeah.
to cook, so that's cathartic for me to
Yeah.
chop in.
The hobbies,
It
yeah.
makes the week easier.
So prepping and cooking, right? Finding that kind of joy and that pastime, and then also takes the decisions out of later in the week, right? So you don't have to stress, what are we going to have for dinner? It's already done. Yeah. I joke about alcohol. We'll talk about alcohol later, but oftentimes, folks say, well, at the end of the day, I have myself a couple drinks because it's my reward, right? I got the kids to bed, the grandkids got back home. And it's my downtime, right? And we'll find out, maybe not the best kind of downtime, right? And that's why I encourage you to find a list of a couple things that might help, because some days, okay, yes, I want to have my drink, but you might say, yeah, this maybe isn't serving me very well. What other options do I have? Maybe it's just getting out and walking, getting some sunshine, right? Getting out in nature. Maybe it's calling up a friend or a family member and just having that conversation, right? So managing stress, this is hedging against that market volatility, right? There's going to be ups and downs, but how do we really kind of manage it? So restorative sleep, right? This is our return, right? So sleep is so important. Not only does it help just our body rest, but there are important processes that happen while we sleep. We're coming to find out that sleep is where our body cleans out the junk in our brains. Not the junk as far as thoughts go, but the waste products of our brains working throughout the day. And those folks that have had trouble sleeping throughout their lives are higher at risk for developing things like Alzheimer's. And it's because they didn't have that restorative sleep that they needed. It affects our circadian rhythm too. And circadian rhythm is just not our internal alarm clock. Oh, we wake up at 6 and we go to bed at 10. But it's also what regulates our hormonal kind of sequences throughout the day, right? So sunshine in the morning affects our dietary and nutritional kind of hormones, right? Our hunger hormones, our insulin, right? And so those that aren't sleeping very well may have trouble with weight loss or managing their diabetes. And so sleep plays a super big role in our health in general too. The goal is 7 to 9 hours of sleep a night. Less than 7, usually we're not getting enough restorative sleep. Over 9, oftentimes we see higher levels of cortisol and stress hormones. And so if we can kind of find that medium area, it's going to be better. I know that as we get older, sometimes we're getting up and going to the bathroom a little bit more through the night. And so whether we work with our docs to address that, is it prostate, right? What's going on? Is it sleep apnea? Sleep apnea, I think, is widely underdiagnosed and increases our risk for heart disease, weight gain, high blood pressure, stroke. And so if there's concern for sleep apnea, go ahead and get evaluated for it. Folks that have sleep apnea that's untreated live on average 8 years less than those that don't. So you're talking about a return on investment, right? Getting that sleep apnea treated is super important.
How do you train your dog to not get up?
Well, that's a good question too, and I am not a dog trainer. The question was, how do you train your dog not to wake you up at 5 a.m.? That's a good question. We have things that interrupt our sleep, and so that might be going to bed earlier, anticipating that our dog's going to wake us up. That might be working with a dog trainer to say, hey, how can we manage this? Do we put them in a kennel or a crate? Do we not let them sleep in our bed, right? So there's things out there, but that's a good question and a very individual answer that I can't help with right now. But it's a realistic thing, right? There's things that wake us up. We have partners that share beds with us. We have animals in our home, and so those things are sometimes outside of our control. But really, kind of doing our best to work with sleep. Yes, ma'am.
Would you please define sleep apnea?
So sleep apnea are periods of time where you stop breathing while you sleep. Oftentimes we look at apneas as the stopping breathing, or hypopneas where we don't breathe as well. And so some folks, what happens oftentimes is you get relaxing of the soft tissue in the neck and those airways close, and then you're kind of holding your breath until your body realizes, hey, we're not getting enough oxygen, and then it wakes up enough not to wake you up, but enough to get those muscles to strengthen back up and open the airway. And so for some folks, and for myself personally, I mean, I had 80 times an hour, which I stopped breathing, which was pretty severe, but it can make a big difference. And you think about it, you're essentially fighting to breathe all night long, right? So the stress hormones are up, you're fighting the bear all night long, you're waking up not restored, headaches, dry mouth, you're getting up all the time peeing, right? So if there's concerns or questions about it, talk to your doctor, because there may be things that you can do. And there's even home sleep studies and stuff that they can do now that you don't always have to jump right into like sleep in a room in some random building for the night. So, yeah.
What about daily naps?
Daily.
Retired, I take a nap every day.
Right. And so daily naps may be helpful, but they also may make hard sleep at night, right? So what do we do about that? Are they worth it? Are they not? There's a lot of question about that, and everyone's kind of a little bit different about how much sleep they might need. If you didn't sleep well, maybe be helpful, but you don't want to sleep too long either, because it's going to interrupt your overall sleep patterns, and then it starts throwing things off, right? So, but that's a good question. And sleep during naps, if we're not sleeping during the day, is a big thing. But it throws off that circadian rhythm and other things too. So making sure you're opening the blinds, getting sunshine first thing in the morning is super important too, because that's important signals for your body to know, hey, it's daytime, I need to get things moving. The last thing, I put some information here. The last thing, big thing and before we move on, limit screen time, okay? So what happens in the brain is when the lights go down, when the sun sets, we make a hormone called melatonin. You may have heard of melatonin. Melatonin is the sleepy time hormone. It helps us get tired. It does a lot of other things, also regulates other hormones, including insulin, but it helps us get tired, okay? So our caveman bodies, when the sun went down, when the wavelengths of light changed, that's what got us tired and we went to bed. Nowadays, TV screens, computer screens, telephone screens, all have that same wavelength of light, and so now we're tricking our body to think the sun is still up. And so you're not making the melatonin, your body doesn't know what to do, and so when you turn off the TV finally and decide to go to bed, it takes another 90 minutes for your body to start ramping up that melatonin production in your brain. And so if we're having trouble falling asleep, staying asleep, really focus on that screen time. You want to get that turned off, at least an hour before bed if you can. If you read on a reader, find a paper book. Journal, write, find something quiet to do, listen to music, but try to keep the screens off. And so there's a lot of other sleep hygiene things we can talk about, but that's a big one. So, so next screen. So dividends of community. Okay, community is super important. The Surgeon General of the United States has said that isolation was the next kind of pandemic, right? Like we have conditions like depression and anxiety that come from being on our own, trying to do our life by ourselves. We can feel kind of helpless oftentimes when we don't have that community around you. There's some studies that looked at, the centenarians, folks that live up to 100 years and beyond, right? They looked at these blue zones, they call them. And those folks that lived the longest had community around them. And whether that's family or friends, whether that's a church group, whether that's around a hobby, super important. So if I were to say action steps here, really figure out how do I cultivate the relationships around me? Where can I be proactive about seeking community? And if you can't find it, create it, right? Like, hey, I really like, watching Westerns. Can I find folks that are also interested in watching Westerns and do it together, right? Do I like playing golf? Can I find folks that are maybe interested in playing golf? So Volunteer is also important, a way to give back that can also build community and also help with resilience in periods of time when we're stressed. Giving back can help you feel as though you've got purpose. And so sometimes we start to feel like, hey, what's my purpose in life? I've worked a hard life and now things have changed. I'm sitting at home, I'm retired. I used to have this wonderful job and now I don't have it anymore, and I sit here and watch TV all the time. But finding that way to give back can go a long way. So volunteerism is important. Next slide. Last thing, right? Eliminating high risk and low reward activities, assets, right? So big things that come here: alcohol. We think about tobacco. We think about things like marijuana. And then we can start talking about other things like what's in our soaps and detergents and these other kind of chemicals that maybe not serving us well. But the biggest thing, I mean, alcohol is probably number one, right? And they used to say, okay, yes, all right, guys can have 2 drinks a day, women can have 1 drink a day, and it may be best for the heart, right? Was that a glass of red wine? Well, data is starting to say, okay, maybe that's not so true. The more alcohol we have, the more likely we are to have heart attacks, and there's a direct correlation between the number of drinks you have and your high blood pressure. The more drinks, the higher the blood pressure. And so folks that quit drinking oftentimes can come off some of their medicine when decide to make that change, right? So, but these things may not be serving us. We may be using also to maybe self-medicate against other things like depression and anxiety. So thinking about ways, hey, how can I limit this? Can I, you're not saying you don't drink alcohol. If you want to have a nice glass of wine, you're having it in celebration, that's great, use it. But when you think about overall health, may not be serving you like you think it might. So mindful consumption, if any, and awareness that other substances may be detrimental. Am I drinking out of the plastic water bottle and those other things? Okay, those are important. Probably need to address the alcohol and the diet and the physical nutrition, and those things are going to move the needle more than the plastic water bottle will, but focus on that. Okay, next slide. So, right, what do we do? Kind of synthesizing and kind of putting it together. There's not a one-size-fits-all plan. I don't want you guys to think that it is, and you do all of this and you're going to be, 100 years old and running a marathon, right? But you got to figure out where you're at. We're all on a spectrum in all 6 of these categories. And so there may be ways that we can move towards better health. And the reason why you're here and the reason why I'm here is that, yes, we're making investments. We're making financial investments. We've got advisors that are there to help us do that. But if our health isn't great, we're not going to be able to take advantage of those financial investments, right? And so what can we do now to really set us up for the future? How can we invest in ourselves so that we can enjoy that in our future, or maybe our family can enjoy those things in the future too? So, I want you to think about it. You can do this now if you want, in your phone or on a note card. I've got some papers in the back. Write down one thing that you want to start changing. And I don't want it to be a big goal, right? I want to lose weight. That's great. But how, right? So I want you to be very specific, okay? So if I want to eat better, maybe I'm really only eating 3 servings of vegetables a day. And I feel like I could maybe eat 4. I think that's realistic. Write that down and put a time frame to it. For the next week, I'm going to work hard to get 4 servings of vegetables a day, right? And at the end of the week, figure out, hey, did that work? What were my successes? Where were my kind of barriers? What made it harder for me to do that? And then reassess, make another goal for the next week. Maybe it's consistency. Maybe it's like, oh, that was easy. Yes, I can do that. Or maybe that was hard. Maybe I just try to do it again. Maybe I find other ways to meet that goal. So I want you to think about at least one thing from today that you can start making a change on to help improve your health. These are those 6 categories again. I've got papers in the back that describe all of these, right? So help pick yourself up one. I also have a lifestyle assessment short form. And so these are just some screening questions oftentimes we use in the doctor's office to figure out where we are in each of these categories. And it allows us to understand where we can start making making changes. Bring it to the doc, but if you can't, look at it. I mean, it's obvious that, some of these exercise, we want to, get 5 or more times a week, or at least get that 150 minutes. You can work towards it and figure out where you are so you know where you can go. But take this with you. I also have something back there. This is just the American Institute of Cancer Research recommendations for cancer prevention. So, cancer is one of those things that we were thinking about. It's kind of a risk, right? That cardiovascular risk. What can we be doing to prevent cancer? And a lot of the things we talked about today are on that sheet of paper. And so really starting to move the needle on your overall health. Those are the big things for me. Think about what resources and teams you have around yourself too. Use your primary care doctor. If you haven't been in a while, maybe make that a priority too. There are preventative things and cancer screenings that are super important, vaccines, other health screenings that may be important for health. But talk with them about what's going on. Utilize them to help set some of these goals. If you're interested in health coaches, I use them with my patients all the time. And it extends my touch to the patient. I can make recommendations. I've got 30 to 60 minute appointments with my patients, 90-minute physicals. Not everybody has that. But even then, sometimes it's hard to dig into all of this in that amount of time, right? Our health coaches can really help figure out where you are and make those goals. Like sometimes we call them accountability coaches too, because we know what to do, but it's actually putting it into action is the hard part. And so somebody to hold you accountable and put it into action is good. So whether it's a health coach or somebody that you can work with to do that. So I'm happy to help take any questions for you.
Thank you all for questions along the way. I don't know if we have, we're right at 1 o'clock, but love to capture any additional questions while we have the time.
How do we find information about how Partner MD works? And so,
Yeah, so Chris has got some information that he can help you with too.
Yeah, if anything, Wes, and if I can just send information, email back to this entire audience plus anyone online. But yeah, we'd love to talk more about any interest you may have and the options that we have. We have 3 offices here in Richmond. Dr. Paine is in our main location in Forest. We have one in Midlothian and one in Short Pump.